A 65-year-old man comes to your clinic with his wife. She's concerned because he's become much slower in his movements over the past year. He's also developed a tremor in his right hand, especially when he's just sitting and watching TV. When you examine him, you notice he has a shuffling gait, a masked, expressionless face, and a pill-rolling tremor in his right hand. What is the most likely diagnosis? If you guessed Parkinson's disease, you're absolutely right. This is a classic presentation you might see on a USMLE exam question, but it's also a reality for millions of people worldwide. So, what exactly is Parkinson's disease? It's a progressive neurodegenerative disorder, which is a fancy way of saying it's a brain condition that gets worse over time. It primarily affects movement. You saw the classic symptoms and signs in our case. A resting tremor, often described as pill rolling, slowness of movement, called bradykinesia, muscle rigidity or stiffness, and postural instability, which means trouble with balance and coordination. This can lead to a shuffling walk and an increased risk of falls. Other signs include that masked facial expression, softer speech, and smaller handwriting. So, what's happening in the brain? The core of the problem lies in a part of the brain called the substantia nigra. In Parkinson's, the nerve cells in this area that produce a chemical messenger called dopamine gradually break down and die. Dopamine is crucial for coordinating smooth, controlled muscle movements. When dopamine levels drop, the movement symptoms of Parkinson's appear. It's like trying to drive a car with less and less gas in the tank. Eventually, things just don't run smoothly. Now, let's talk about treatment. While there's currently no cure for Parkinson's, we have excellent treatments to manage the symptoms. The mainstay of therapy is a medication called Levodopa, which the body converts into dopamine. This directly replaces the missing chemical and can dramatically improve motor symptoms, especially in the early stages. Other medications, like dopamine agonists, can also be used, but beyond medication, physical therapy, occupational therapy, and speech therapy are incredibly important to maintain mobility, function, and communication. In some cases, a surgical procedure called deep brain stimulation, or DBS, can be an option for patients whose symptoms are not well controlled by medication. Finally, what's the prognosis? Parkinson's disease is a chronic and progressive condition, but the rate of progression varies widely from person to person. It's important to know that it is not considered a fatal illness itself. With modern treatments and a comprehensive care team, many people with Parkinson's live long, fulfilling lives. The goal of treatment is to manage symptoms and maintain the highest possible quality of life for as long as possible. I hope this helped you understand this important condition a little better. If you found this video useful, please give it a thumbs up, hit that subscribe button, and ring the bell so you don't miss our next one. Thanks for watching, and see you soon.